Hi girls, today I thought I would put together a short video of a few of the basic abdominal exercises that I would go through for the girls that are in the early postnatal period and starting to attend classes. So this is often for the ladies that are around the 6 week to 4 months postnatal, or alternatively they might be a little bit further along but perhaps have struggled with quite a large abdominal separation or some pelvic floor or back issues. So before we get started, I wanted to give you a little bit of a reminder about the breathing that we need to do during all the exercises because the rib cage position has a big effect on how well your abdominals are actually able to work. If you have your rib cage lifted, it's really hard to get that tummy wall coming on. So we need to really try and make sure that the front chest wall here when we're exercising is relaxed down. And for people that have quite a rounded upper back, you can find when you lie down that naturally the rib cage is going to lift because you need to try and get your head back onto the floor. So if you are a bit rounded in your upper back, I'm going to suggest that you put a folded towel that just goes to the height of a few centimeters, about 5 centimeters off the floor, place it under your head, and just by putting that in underneath, you'll find that that will relax down your chest wall through the front. Now, when you are breathing, I also need you to think about making sure that you're allowing your tummy wall to fill with air. So when we take a breath in, the lower belly area here, you should actually feel that tummy swell out a little bit. So if you were to place your hands over your lower tummy wall, then as you take your breath in, you feel that you breathe into your tummy first, and then as the breath gets slightly deeper, that breath moves then into the lower part of our rib cage, and you'll feel that the lower ribs will then just slightly expand out to the side. So if you put maybe one hand on your lower tummy, one hand to the side of the rib cage here, as you breathe in, we feel into our bottom hand, and then a little bit into our top hand, and then as you let the breath out, you'll feel top hand and lower hand sink back in to their starting position. So we breathe in, we fill into our tummy, the hand at our rib cage will move a little, and then as we exhale, they sink back in. Now the way we breathe is also connected to our pelvic floor. So when we take our breath in, our pelvic floor should very slightly descend, so we're releasing some of the tension out of it. And then as we exhale and the breath comes away, our pelvic floor should lift. And initially after you've had a baby, sometimes that automatic action doesn't really work as well. So I tend to get ladies focusing a bit on that. So if you have think about your pelvic floor as you breathe. When we breathe in, we need to allow that pelvic floor to let go. And then as we exhale, I want you to feel yourself just generate a little lift through the pelvic floor muscles. Breathing in, let the tummy fill. Ribcage hand moves as well. And then as you exhale, get the little lift through the pelvic floor. Okay, and try and use that breathing pattern through the exercises we're doing. Even if you find the breathing muddles you a little bit to start with, at least just try hard not to hold your breath. So we'll start with our knee fall out exercise. You're going to be lying on your back with your knees bent. Your feet and your knees should be about the width of your hips apart, and they should be about 20 or 30 centimeters from your bottom. Remember, if you are a bit rounded through that upper back, to pop another folded towel underneath the head to help relax your rib cage down at the front. Okay, so thinking about our breathing with this, I like to get hands-on. So for a lot of exercises to start with, it's a really good idea to put your hands on abdominal wall or over your perineum if you're trying to feel for pelvic floor support, just to give you some better feedback. So I think it's really easy to be a bit disconnected with our muscles, particularly some of those deeper ones when you've just had a baby. So I'm going to place my hands over the lower part of my tummy through the exercises. Okay, when you're lying in this position, make sure that your back isn't pushing hard into the floor and that it's also not perched up like this. So just let that rib cage drop down, and there should just be enough space in your back to fit your fingers in underneath. Hands in the lower tummy area, and you're going to feel for whether your hips twisting through the movement. So as our knee opens to the side and comes back in, there should be no movement across our hips. Those hips should stay nice and level throughout that. And the knee that's not moving should do exactly that. It should stay pointing to the ceiling and not try and counterbalance you by rolling out. Okay. So we're in position now. And we start the exercise. So breathe in, let the knee fall out to the side, controlling that movement. Tummy fills. As you exhale, lift up through your pelvic floor and feel a little bit of tension across that tummy as you draw the knee back to the midline. Inhale, let the tummy fill. As you exhale, feel the little lift through your pelvic floor, drawing in across the lower abdomen, bringing the knee back to the center again. Inhale to open. Exhale to draw back. Inhale to open. Exhale, tummy, pelvic floor, back to the center. Now the progression on from there would be to add a little hand weight. And so when you're doing this, the hand weight goes in the opposite arm to the leg that's moving. And you're going to be opening that weight out to the side and bringing it back in. So we've got a weight here. Start with that weight directly in front of your chest. Let this arm just sink back down towards the floor, but don't bend your elbow. So the elbow is soft and the arm is almost straight. You're going to be opening that arm directly to the side and then drawing it back into the middle. And you'll do that at the same time as the leg opens. So the leg and arm will open together and then they'll close. So let's have a little go at that now. Breathing into open. Exhale, lift through pelvic floor, tummy. Bringing the arm and the leg back in, and make sure you try and coordinate that movement so they arrive at their end point at the same time and they move back at their starting point at the same time as well. Inhale to open. Exhale to close. Now you can obviously change the heaviness of your weight to make it more challenging. So I suggest just starting with about 1 kilo and then maybe working your way up to a couple of kilos. Because the arm's fully extended, you've just got to watch that you don't load too much weight into it so that you're not straining through the shoulder. Okay, so that's a nice sort of intermediate step. The next step you can do is to do this on a foam roller. So a foam roller is a really lovely apparatus that you can use to really challenge the stability that you have or the control that you have through your trunk. So the foam roller I've got here, I just grabbed from Kmart, $8, so it doesn't need to be anything too fancy. We're going to lie our trunk along the length of that, do exactly the same exercise as we did with the weight, but this will make it a lot more challenging. Just be careful when you use a foam roller that you lower yourself down through your side and just don't go straight back, because otherwise you can strain through that tummy area, put a lot of load down through your pelvic floor. So try and go down through your side. Make sure you've got enough length that your head's fully supported. Again, bring the legs in nice and narrow. Let's try it on the other side this time. So arms up, make sure shoulders dropped back down. Check you've got just that gentle curve in that lower back, okay? And then the other hand can again feel the tummy or the hips. Breathing in to open. Exhale to close. Inhale to open. Exhale to close. Inhale to open. Exhale to close. So those are variations of knee fallout exercise, getting progressively more difficult. That are a nice way to start building up some tension again through the central tummy area if you've got a bit of a diastasis or abdominal muscle separation. Okay, so another exercise that you can add to those knee fallouts is leg slides. I'm going to start our leg slides using a ball underneath the leg that's moving, just so that I can work on getting some lovely movement from the hip independent of the trunk, and then we'll progress on to moving that ball out and then adding another arm weighted movement to that to increase the challenge. Okay, so one leg is bent with the foot flat on the floor, the other foot is sitting rested on top of the ball. Check again the position of your lower back, that it's not pushing hard into the floor and that you've just got enough space to fit your fingers underneath. Also make sure that the rib cage is again relaxed down at the front and not pushing up. So relaxing into the floor. All right. Use hands to feel the central area of your tummy to check that you're not bulging up into your fingers. So you've got to be able to make sure that you're controlling this area so that it's staying flat or sinking slightly down as you do your out breath. So we're going to start our breathing with inhale to extend the leg out and exhale to bring it back. Let's have a look. Breathing in, fill into your tummy, extend the leg. Exhale, pull it back. Inhale to extend. Exhale, zip up that pelvic floor. Pull it back. Breathe in. Breathe out. Breathe into that hand. Breathe out. The progression, move the ball away. Without moving your hips, slowly peel that leg from the floor. And we go again. Breathe in. Extend it just above the ground. As you exhale, tummy, pelvic floor, come back. Breathe in. Extend. Exhale, get that lift through your pelvic floor, setting through the tummy. You don't have to work really hard with that. If you feel that it is starting to dome the front area of your tummy here, then stick with the knee fallouts or stick with doing this one with your foot on the ball for now. Inhale out. Exhale back. And check that you're not getting movement through your trunk as you do it. The progression you can add to those leg sides is to add some weight to the arms and add an arm movement to it, so it becomes more challenging to control your trunk when you've got both leg and arm movements going on at the same time. So I'm going to hold the weight in both hands to start with, and then you can change that and just do the weight in the opposite hand to the leg that's moving. So have a look at that. So the arms are going to lift up above your head. Just be looking out for the feeling of your rib cage starting to lift. So if you're quite tight through there, don't try and take the arms back too far, because you'll then compromise the position of your rib cage. So we're going to keep that relaxed down into the floor through your sternum. The arms start in front of your chest and you're going to peel one leg off. And then we go again. So we're going to breathe in, open, without raising that belly button up. And then as you exhale, lift up through your pelvic floor, set the lower tummy, and slide arm and leg back. Inhale to open. Exhale, control tummy. So you might like to try that with one hand holding or feeling the front tummy wall and the other hand raising. So it would be breathe in and breathe out. Now you don't have to fully extend the leg either. So if you feel at this point that that's starting to make it too hard to control the tummy, then leave that leg a little bit bent and come back in, or get rid of the weight and just do the arm movement without any load in the hand. So that's leg slides and another really nice variation to start building up that tummy tone.